The COVID-19 pandemic and how Singapore manages it have shown that we are likewise able to prevent the rise of chronic illnesses that come with getting older. Health Minister Ong Ye Kung discusses this preemptive approach during a panel on the future of healthcare at the Indonesia-Singapore Business Forum.
When you age, you just fall sick. And in the case of Singapore, it's not just aging, but age for age, people are actually getting less healthy. You get more chronic illnesses. I think it's just our lifestyle, more sedentary, less exercise, eating better food maybe, and less healthy food. So all this is adding on to our burden. Then came COVID, and as Pak Budi say, you never waste a crisis. And COVID showed us what can be done to help reverse some of this. You cannot control the escalation in terms of aging and sickness, but you can bend the curve. Just as we bend the COVID curve, we need to bend the chronic illness curve. And that is through preventive care. Just look at ourselves. The basic mindset is by the time we fall really sick, we have to go for an operation. It's painful, it's expensive, it's a burden emotionally to our family. And then you start to regret, why don't I eat less char kway teow, eat less laksa, or put less sugar, put less salt in my diet, which was little sacrifices that we could have done, but we will not do it now because we have not seen the price. But every day we do this and lead unhealthy life, we are paying the price later, or we are incurring a price that we will pay later. So how do we make people do the right things now? COVID showed us how. Because of COVID, people are now taking vaccinations, people are wearing masks, people are reminded through their apps, and there's just so many policies that previously we say cannot be done, but because of COVID, it can be done. In the case of Singapore, one major policy change, other than vaccination and masks, is that the whole GP sector, all our private clinicians, family doctors, become part of the public health system. They are out there attending to patients with COVID, making decisions. Do you rest at home? Do you go to hospital? Do you go to an isolation facility? Do I test you with ART or do I test you with PCR? And they are making all those triaging and medication decisions on the ground as part of our system. Imagine we convert that entire machinery into preventive care. That you and I, who are all healthy, we will see a doctor, just as we see a doctor during COVID. We'll see a doctor and they will make sure we do our health screening. They'll make sure that we practice healthy lifestyle, eating, sleeping, dieting, exercising, doing all those things well. And it will prevent so much pain and expenses later on in life.
Thanks for watching. Be sure to subscribe to the channel and hit the bell icon to be notified of new videos.